Hello, everyone. I'm Wan-Ting Cui. I'm from Icahn School of Medicine at Mount Sinai in New York City. Today, I would like to talk about using EHR data to identify social determinants of health affecting disparities in cancer survival. Cancer screening has become an important topic in the past 20 years, and various tools and methods used to detect cancer also improved drastically in recent years. As a result, the 5-year survival rate has increased significantly for multiple cancer types. A majority of studies focus on the medical determinants that related to cancer survival. There has been some studies on social demographic factors affecting disparity in cancer diagnosis and cancer screening. However, most of these studies focus on the demographics of a single cancer type or selective demographic groups. We think the cancer screening and treatment should improve survival across all population subgroups. So the goal of our studies are first to provide a comparative overview of social demographic differences in 5 major cancer types: breast cancer, colorectal cancer, lung cancer, multiple myeloma, and prostate cancer within one health system in New York City. Second, we want to provide an initial assessment of a number of social determinants of health as potential drivers of disparity in cancer survival, especially for those who decease in a short amount of time after diagnosis. The data set we used was generated from electronic medical records from Mount Sinai system. The time period we used was from 2003 and to 2019, we used all 5 cancer types. The variables we used were age, sex, race, a live indicator, cancer diagnosis date, and death date if applicable. We separated patients' age into 3 levels: young adults, middle-aged adults, and older adults. We excluded children, and we also excluded patients with missing values. In the analytic data set, we extracted 2 subsets from the original data sets: patients who survived a short period of time and patients who survived for a long period of time. We define patients who survived a short time as patients who survived less than a year between diagnosis and death. And we define patients who survived a long time as patients who survived 5 years or more after diagnosis. There were 2 sets of patients in this category. For patients who are alive, we included those whose diagnosis date were earlier than 2015. January 1st, 2015. And for patients who are deceased, we included those whose number of days between diagnosis and death are greater than 1,825 days, which is 5 years. In the first part of our analysis, we performed exploratory data analysis, and in the second part of the analysis, we plan to investigate the effect of demographical factors on patients' duration of survival by using logistic regression. The independent variables are age, sex, and race, and we define the dependent variable as whether a patient survived a short period of time between diagnosis and death. There are 22,096 patients in the data set. 1,280 patients survived a short period of time, and 20,816 of them survived a long period of time. There are overall more breast cancer patients and prostate cancer patients. Although there are less overall colorectal cancer and lung cancer diagnosis, there are significantly more lung cancer patients and colorectal cancer patients that survived a short period of time compared to the other 3 types of cancer types. So this is a graph of the percentage of overall cancer types by months between diagnosis and death. We can see that the previous disparities were true for up to 12 months. And there are significantly less breast cancer and prostate cancer patients survived a short period of time. In addition, for lung cancer and colorectal cancer patients, there were more deaths occur for the first 3 months between diagnosis and death. Here is a summary statistics of 5 cancer types based on the 2 survival level. In lung cancer, the average age for patients who died within 1 year are 70 years old, comparing to 67 years old for patients who survived for over 5 years. Most patients who were diagnosed with lung cancer were middle-aged adults and older adults, and most young adults who were diagnosed with lung cancer survived. However, we identified like 4 young adult patients who diagnosed with lung cancer and disease with 1 year of diagnosis. In addition, there were more female patients who were diagnosed with lung cancer and survived, whereas there were more male patients who were diagnosed with lung cancer and disease within a short period of time. Race was also an important factor. There were higher proportions of non-white and non-Asian patients who were diagnosed with lung cancer and disease in a short time. There were less patients who deceased from colorectal cancer within a short period of time comparing to lung cancer patients. For colorectal cancer patients, the average age of patients who survived a short time was 72 years old, and the average age for patients who survived a long time was 62 years old. Similar to lung cancer, most patients who were diagnosed with colorectal cancer were middle-aged adults and older adults. There were more male patients with colorectal cancer than female patients in both long-term and short-term survival groups. But the proportion of the male patients who deceased in a short time was higher than those who were survived for over 5 years. Also, there were significantly less patients who deceased within a year from breast cancer, multiple myeloma, and prostate cancer. There were higher proportions of Black patients who deceased within 1 year, and then the proportion of Black patients who survive a long time across all 5 cancer groups. According to logistic regression results, older age, gender, and race were significant factors for lung cancer survival. Male patients were likely to decease in a short period of time than female patients. And the odds of Black patients and other race patients, which normally constitutes of Hispanic patients and Mount Sinai, disease in a short time or higher than that of white patients. In colorectal cancer, compared to younger adults, older adults with colorectal cancer were 3 times more likely to survive less than 1 year after diagnosis. In addition, similar to lung cancer patients, male patients were likely to survive a short time compared to female patients, and Black patients were more likely to decease in a short time compared to white patients. In multiple myeloma, older adults and Black patients were at higher rates of death in a short time compared to young or white patients. For breast cancer and prostate cancer, we tested the influence of age and race. For both groups, the odds of older patients and Black patients surviving only a short period of time were significantly higher than that of middle-aged patients or white patients. So race was an important factor. There was significantly more portions of Black patients deceased in a short period of time than in a long period of time. This disparity was observed in all 5 cancer types. And when comparing with other race, Black patients are more likely to decease in a short time after diagnosis compared to white patients. And Hispanic patients with lung cancer were also at risk of shorter survival length compared to white patients. So promoting routine cancer screening is important in Black and Hispanic communities. Also, there were significantly more lung cancer patients and colorectal cancer patients who deceased in a short time compared to breast cancer, multiple myeloma, and prostate cancer patients. Older age, especially for patients who are over 65 years old, was a significant age factor for all cancer types. Gender was a significant variable for lung cancer and colorectal cancer. Since breast cancer and prostate cancer were gender-specific cancer, we didn't include these variables in the evaluation. For lung cancer, there was a high proportions of female patients who survived a long time than male patients. Yet there were more male patients who deceased in a short time than female patients. Furthermore, there were more male patients who were diagnosed with colorectal cancer in both survival levels. In future studies, we would like to add more variables into our analysis, and we will also look into patients' medical histories, and we also plan to apply unsupervised machine learning method to discover latent clusters within each cancer type. In conclusion, in the study, we produced descriptive statistics of patients' demographics of lung cancer, colorectal cancer, breast cancer, multiple myeloma, and prostate cancer. After that, we identified demographical factors that affects patients' length of survival by performing logistic regression analysis. Age, gender, race were significant factors for lung cancer and colorectal cancer. Age and race were significant factors for breast cancer, multiple myeloma, and prostate cancer. Older adults, male, and patients in Black and Hispanic communities were the people most susceptible to shorter length of survival after cancer diagnosis. Thus, promoting cancer screening for these demographic groups were crucial to help identify cancer in early stages. This is my presentation. Thank you for listening. If you have any questions, you can contact me at wangting.cui@msm.edu. Thank you.